My name is Hamunyela, and I will be your director of proceedings for this very important occasion and handing over of the medical equipment. Firstly, allow me to recognize the presence of our Honorable Governor, Honorable Hambyuka, who is the governor for the great Kavango East region. I would also like to recognize the presence of Professor Peter Nyarango, who is a surgeon, a consultant, a researcher, and the former dean of the Faculty of the Health Science of UNAM, representing Professor David Namwandi. And I would also like to welcome our colleagues, fellow health professionals, our consultants, our medical officers, our sisters, nurses. So to begin with, I would like to ask Sister Hausiku to grace us with an opening prayer. Sister, the floor is yours.
Thank you very much. I think you can thank you. Let's just bow our heads as we pray. Everlasting Father, we thank you for this wonderful moment. You have brought us together to celebrate something good. Father, we thank you that each and everyone is healthy and alive today. Thank you for journey mercies for our colleagues who traveled so far to come and hand over some equipment because of the love they have. Father, someone needs to have love for it to flow to the next person. This afternoon, we are standing here to go and receive our equipment for this hospital, and we don't take it for granted. Father, thank you for everything. I pray that IUM will prosper. I pray that each and everyone who's going to use this equipment, they will make sure that they will take care of them like their own properties. I pray, Lord, that interns who are going to be taught using this instrument, they will become great doctors. All this I ask in the mighty name of Jesus. Amen.
Thank you, Sister, for that powerful prayer. So in our African culture, we do not start any proceedings without being greeted. So allow me to invite Dr. Shivera to deliver the opening remarks.
Thank you, Dr. Kaya. Good afternoon, Honorable Governor of Kavango East Region, Honorable Hamunyela Hambyuka, Professor Peter Nyarango, researcher and consultant, International University of Management School of Medicine, representing Professor David Namwandi, founder and chair of the International University of Management, executive members of Intermediate Hospital Rundu, Dr. Theresia Shivera, our Director of Ceremonies, distinguished guests, staff members, members of the media, fellow health professionals, ladies and gentlemen, good afternoon once again. My name is Dr. Theresia Shivera. I'm the medical superintendent for Intermediate Hospital Rundu, born in Rundu in this hospital and back at home. It is indeed my great honor and pleasure to welcome you all to this significant occasion. It's the official handing over ceremony. I know it happened 2 weeks ago, 2 weeks or 3 weeks ago in Rundu, but we have decided to bring it home. Honorable Governor, we wanted you to experience what we felt in Rundu. I'm not going to cry this time around, Prof. Nyarango. Yes, this is the handing over of the medical equipment to our hospital by IUM. And as we all know, this hospital serves regions, our own region, Kavango East, Kavango West, Zambezi region, and the neighboring Angola, who celebrated the Independence Day yesterday. Today's event marks not only the delivery of essential medical tools, but it's the beginning of a journey which we started in March this year. Prof. Nyarango, if you remember. This conversation started in March. But I know Prof from 2018 when he was at UNA, and I'm sure he's happy to see that some of his students are sitting amongst us as our staff members. So the whole objective of this was to strengthen our healthcare system and to reaffirm our collective commitment to improving the well-being of our people. This generous support from IUM valued, the papers say 8.5 million, but our Minister of Health actually said it's probably more than 8, it's probably 10 million Namibian dollars, is a practical demonstration of what we can achieve when government, academia, and health sector work hand in hand. And this is towards the shared vision. Okay, this is the delivery of accessible, affordable, and quality healthcare to all Namibians. This is in line with the ministry's new vision of world-class health for all. These medical devices will enhance our ability to provide timely and effectively medical care, especially in the surgical discipline, which I'll mention just a few. Obstetric gynecology, they received some Caesar packs. Orthopedics, they received a C-arm electric operation table with its traction frame. General surgery, the laparoscopic tower with all its accessories. Anesthesia. Anesthesia, it's an anesthetic machine with laryngoscopes. Theater, many more items there. With theater scrubs, emergency unit, maybe they might get the arterial blood gas analyzer. Intensive care unit, maybe you might get the patient monitors, and also pediatrics got a lot of items as well, and then radiology. With this, once again, thank you, IUM, and I welcome you all warmly to this event, and please celebrate this event with us. I thank you.
Thank you, Doctor. As they say, dynamite come in small packages. That is what I always call my medical superintendent, our dynamite. Thank you once again for the warm welcome. Moving on, would like to give the floor to Prof to just give us some few remarks. Welcome. Thank you.
Honorable Governor, fellow doctors and nurses, I was not intending to make any speech until Professor Namwandi had an urgent calling, and then he asked me to proceed. And in line with the training of surgeons, I could not decline. So I decided to follow Dr. Shivera and my other students to come and see what has happened since I was here almost five years ago. It's not going to be a long speech. Simple to say, apologies from Professor Namwandi, the founder and IUM founder and chairman or chairperson of the governing council of IUM. He was not able to come, but he is here with you in spirit, and I believe that at an appropriate time, he has promised to come and visit Rundu Hospital and see how you are benefiting from the donation from IUM. Just a few comments. Personally, I'll make a few comments about it on my own behalf before I go to Namwandi. Personally, I feel very much at home being at a regional hospital. I started my journey in medicine at a regional hospital like this, which was also struggling. But I can tell you that probably I performed more prostatectomies in that hospital than I did when I became a surgeon, as an intern in training. we brought it up from a kind of small facility into a really teaching hospital. And then he went into a teaching hospital. He went to another hospital which was below this level. In Kenya, we have what we call district hospital. Maybe this will be Shandy or I think there's one down this way, which is also Nangami. No? Nangami. At that level, and the government of Kenya decided that it will become a teaching hospital. And one morning I was called and given a 5-page letter. The summary of it was that I was to lead the transformation of that hospital from a district hospital into a national referral and teaching hospital, the second one in the country. And the only thing we were given with the dean is a secretary and a room. And it was 1988 or 89. And we were told that students must be in class in 1990. It's up to you to make it happen. Through all of these kind of efforts which we were engaged here, we were able to admit our students on time in 1990. And I'm equally excited to say that 7 years later, actually 8 years later, one of them rose to the level of the ED of the Ministry of Health in my country. Just about 8 years again of being the founding dean of the School of Medicine at UNAM, one of our good students became the Minister for Health and Social Services in Namibia. So I feel satisfied that I performed what the good Lord asked me to perform in medicine. The rest they can do. So I'm very comfortable here. Yedele was one of our best students with his brother. I see is still here. I'm sure there are more. That's all as much as I need to say. The last thing I want to say is that I would like to apply some of my skills and connections to try and replicate what we did in Kenya, transforming a district hospital into the second national referral hospital in the country, and it still is the second. There are only 3. I would like to see the same thing happen to Rundu in the state hospital, rise from where you are at the moment to become probably the 3rd or 2nd teaching hospital in the country. Now, Professor Manamwandi would have said the following if he came in person, and I want to say it without reading it. IUM was started with a very humble beginning about 35 years ago, just under 35 years ago. It reminds us it was with one student and one lecturer. And it rose from the Institute of Education to the current university, which is only second, I think, to UNAM in terms of the student enrollment. I think this year we have about 24,000 students at the IUM. And I have graduated easily, just under 40,000 Namibians have come through that institution. And they occupy very prime jobs in different areas of the economy of Namibia. The next thing I know that he would like to say is that university, which is not for profit, is a not-for-profit institution, is dedicated to the development of this nation. And it's for that reason that the university has created satellite campuses beyond Windhoek. He believes in being immersed in the midst of the population. So if I miss a few of them, it's because I'm also a bit new in that institution. But there's one branch in Nkurankure, which is not very far from here. There is Ongwediba, there is Wavis Bay, and the Swakomo. There is soon going to be a research center. The construction is done. Enana is running already. The idea being that education as a major element of transforming society, but it only does it if it answers to the needs of the community, which it is a foundation. So IUM is committed to running its operations and these campuses close to where the people are. So those campuses are dedicated to transforming the communities around them. I suspect soon you will see actual interaction between the community. We used to call it in many days a community campus cooperation, working with the regional governments, with the district hospitals, with the hospitals themselves. And in this, I must make reference to what I read recently as a pronouncement from Honorable Minister of Health and Social Services, who indicated that there is a transformation on the way that leads to decentralization of the management and delivery of healthcare services. Now, in my country, when they said that, it meant they decentralized the responsibility, but not the budget. So you are left to struggle. But I'm very happy that she started by saying they are going to decentralize the budget. So you get both the responsibility and the authority to spend. That you are very lucky. And now that Rundu is on the verge of becoming a referral center, you are called upon to give the best example. You must grow and show evidence that the efforts being made by the government and other well-wishers like IUM are not in vain. Otherwise, you will discourage the government from decentralizing further. I know for a fact, I was involved in decentralization of healthcare services in Kenya. I went through the mechanics of making that teaching hospital into a state corporation, completely independent, almost independent of the state, because even the appointment of the board was kind of out of the hands of the minister or the politicians, because there were categories of representatives, including the Nurses Association. But I'm afraid that it has been reversed in the course of time, because the government suddenly found that the issues of unaccountability, which were existing in one center called Central Medical Stores, suddenly were multiplied into 46 non-accounting units. And they started reversing some of the benefits that they're given to these centers. So I really appeal to you to make it work and give the government reason to continue to support you. The next thing I want to say is that under the MOU, which has been signed by the International Universal Management and the Ministry of Health and Social Services in Namibia, the parties agreed that they will have some shared responsibilities and obligations. One of them for IUM is that the institution will contribute towards making sure that the operations of the teaching hospitals don't suffer because of lack of equipment and supplies. So IUM promised and is committed to contribute towards the procurement of supplies and giving them to the Ministry of Health and Social Services. You are the first one to get that kind of donation. I know it's valued at 8.5 million, but secondly, the MOU provides that International University Management will recruit 5 medical specialists and once more immerse them into the Ministry of Health and Social Services facilities, state facilities, state hospitals, where they will not only participate in the teaching and training of the mass of medicine students and other students, but will also provide healthcare services, patient care. And I must say that in the first instance, it was decided that with a lot of consultation and a lot of pushing to say, let them go to Rundu. Let us package Rundu as the satellite, so to say, as the peripheral teaching hospital, the first one. So, well, let's say fortunately, when we are advertised for the post, one of the specialists who applied for both the government and to IUM and was offered a job in both places.
Yeah.
And so now, because of the issue of work permit, already that specialist, my good friend Derek in obstetrics and gynecology, we agree that since he's already in the payroll of the government, let him remain in the payroll of the government. But Professor Namwandi has instructed me to state that IUM is still committed to its pledge to provide obstetrician and gynecologist to Rundu Hospital. So he's giving a free hand to the Ministry of Health to say, okay, he's our employee, but pay the salary. So he has said that the IUM is willing to take over the package of whatever package the ministry is giving to our good Professor Derek. I am not afraid to mention his name, Derek. They are willing to take over the package so as to allow the ministry to hire that kind of specialist for some other hospital with the savings. That's the idea. So those two commitments are available to the ministry and also to Rundu Hospital. Finally, we must state very clearly that in consultation with the Ministry of Health and Social Services, we agreed that we shall not immediately replicate what's available in the country. So in 2022, when the school of medicine was started at IUM, it was decided between the parties that the priority would be given to medical specialization. Because already UNAM is giving undergraduate, and there are other arrangements for training from elsewhere. So the priority for our partnership with the Ministry of Health and Social Services is medical specialization. And for that reason, we went out to look for partners international and established an MOU with the University of Zimbabwe to become our immediate partner in the training and the level of medical specialization. Last year, we advertised for admission, and although we admitted just under 10 candidates, because it was new and because it was it hadn't been immediately programmed in the training schedule of the Ministry of Health and Social Services. Only 2 eventually started the course last year. And I'm happy to tell you that the structure of the course is they do 1 year in Zimbabwe, where they do what we call those subjects which are preclinical, before the clinical medicine, the patient care, the basic sciences. They do them in Zimbabwe for 1 year, and then they come to Namibia for the rest of the 3 years. So the course will be essentially be done in Namibia. For that candidate who took psychiatry and mental health, this arrangement is that they do that first year in Namibia, and they get a diploma. Actually, that candidate is due to do his final exam for diploma, and we hope he will graduate next year in January, February, with a diploma to enable him now to go on and do the Master of Medicine. So he's already programmed. He has been very hardworking, and I'm sure he's going to get his diploma and then continue with the rest of the course. The other candidate who was in Woodfontein is also doing obstetric gynecology, and I'm sure next year he will be resident in Namibia. This year we have 12 applicants. No, we had 14 applicants, and we admitted 12. These 12 have already got their admission at the University of Zimbabwe. They are waiting now for the processing in terms of study leave. The idea is that those who are doing these other subjects, like internal medicine, they will go to Zimbabwe for 1 year. Next year, then they come back to complete. So we hope that next year we will send at least 10. And I know that one of them wants to do family medicine. It wasn't part of our package, but I know one of them wants to do family medicine, and is already admitted. So, in other words, what IUM promised the ministry and the people of Namibia is on course. In the context of the program is running already, is approved by Health Professionals Council to run in that manner. 1 year in Zimbabwe, 3 years in Namibia for the first 2-3 cohorts. Come the year 2027, we have already started the process of writing or domesticating the Master of Medicine curriculum so as to be a Namibian course approved by the NQA and the Health Professionals Council and the Council of Higher Education to be run in Namibia 100% from starting in 2027. This curriculum have been drafted. January and February will be even coming to you here for stakeholder discussion of those curricula. They are in anesthesia and critical care, internal medicine, general surgery, pediatrics, child health, psychiatry, and mental health. Those 5 have been drafted by experts, but now we need to bring them for stakeholder discussion. Then we'll take them to NQA, HPCNA, then come 2027, they will be implemented here in Namibia, mainly in Rundu Hospital and Windu, yes, possibly 2 other sites. So those activities are at the advanced stage. By the way, the specialist, Tarek is already here. The anesthetist reports in January. The pediatrician also reports in January. Unfortunately, we lost 3 others because we took a long time to get the work permits, who were in internal medicine and other subjects and would have been part of the group. So we are going to re-advertise, and hopefully we'll get the new candidates. So with those very many remarks, let me now come and say, we came here to witness that the sound arrival of the equipment, and our chief in the area of procurement and accountability of this kind of materials, Leslie, is here to make sure that the material actually reached in one piece in Rundu. So that's the only reason which brought us here, and we are happy to be with you. And I hope the rain is also on the way. Governor, this is now part of decentralization, which is going to be of interest to the regional government, to the governor's office, because those resources are the resources for the community in this region. They own the assets for this community, and so they need to be so treated and so managed. Thank you, and God bless
you. Thank you so much, Prof. This is the time I wish I knew how to ululate. Maybe my fellow sisters can help. Okay, Prof, just some short remarks. Thank you for also reminding us that anything worth having does not come easy. This I derived from the journey that you have shared, and the one that you've shared a little from Prof. Namwandi's as well. So moving on, ladies and gentlemen, I have the pleasure of giving Honorable Governor, Honorable Hambyuka, the floor to give some remarks. So please rise and let us welcome our Honorable Governor.
Good afternoon, let's have our seats.
Yeah. That's good. The floor is yours.
Thank you. First of all, I needed to ask for a sincere apology. Those who knows my voice could observe that this is not my voice. I pick up flu when I was, I don't know where, but it should be in Congola. So I was in Congola for the barrier, I think it's where I pick up the flu. Apart from the coughing, but then I came back with the flu. And the voice was almost ran away from me. The Director of Ceremonies, Prof. Peter Nyarango, Research and Consultant at UNAM, representing Prof. Namwandi of IUM, Dr. Shivera. Some of these people, I avoiding their title. When you find your daughter working there, you cannot say Shivera, Doctor, Superintendent. No. You better say my daughter. Of the Rundu Intermediate Hospital, all other medical staff present, members of the media, ladies and gentlemen, good afternoon. Thank you for joining us on this important day. We are gathered in gratitude to mark a new milestone for healthcare in Kavango East. On behalf of our people, I express deep appreciation to the International University of Management, IUM, for its extraordinary gift to Rundu Hospital. Through the vision of IUM's leadership, equipment worth of 8.5 million Namibian dollar has been donated to the Ministry of Health. We acknowledge with gratitude every individuals at the university who made this possible. Your generosity shows true commitment to improving healthcare of Namibians. The donated machines will greatly enhance the quality of care we can provide. Among the items are advanced diagnostic and life support devices, new ultrasound, sonar machines, and fetal monitors of expectant mothers, endoscopy towers for international procedures, infant incubator, and ICU patient monitors for newborns and critical ill patients, and modern anesthetic and operating room tables. Ladies and gentlemen, this support comes at a crucial time. Rundu Hospital serves not only Kavango East, but also patients from Kavango West, Zambezi, and even our neighboring Angola. It has long felt the strain of growing demand. The hospital has been overcrowded with congested wards and long waits, and has even lacked some essential medical equipment and staff. Mothers in labor or children in distress have sometimes faced heartbreaking delays or been sent on long journeys for care. We have heard heartbreaking stories of neonatal patients traveling 100 or 700 kilometers before finding help. Such challenges in our health system are real and serious. Today's donation helps solve some of these challenges. We are also recognized that equipment alone must be matched by skilled care and maintenance. I urge our hospital management and health staff to make the best use of these tools and to keep them well maintained. Let this gift inspire all of us, health workers, families, and community leaders alike, to work together for better health. Ladies and gentlemen, in closing, let me again convey our heartfelt thanks to IUM. This generous donation will reap through our community for years to come. It reflects the spirit of partnership and care that every Namibian deserves. We pledge to honor this gift by redoubling our effort to save lives and improve health for every family in Kavango East. May we all continue to work hand in hand for the health and well-being of our people, and I thank you.
Thank you, Honorable. The man who walks the talk. It's his name. It's what I always tell him. So for next, we would like to call Mr. Nelson Olabajaya. Is that the right pronunciation? Olabanjo, who is our acting director, instructed by our current director to give us some vote of thanks.
Thank you so much.
Acting.
Honorable Governor, the representative of IUM, Professor Peter, Nyarango, yes. The research professor.
And coordinator.
Dr. Shivera, the medical soup of Rundu Intermediate Hospital. Colleagues in the hospital, the media, ladies and gentlemen, good afternoon. On behalf of the regional director, Ms. Ida Mendai, who is in the Vinduk now, who would have loved to be personally available to receive this donation, I welcome you. Permit me to stand on already established protocols. Ladies and gentlemen, today is a milestone and a memorable day in the history of Intermediate Hospital Rundu, and indeed in our region. On this occasion of receiving this cutting-edge medical equipment to improve our services to our community, which covers the 3 regions of Kavango West, Kavango East, and Zambezi, and of course, our neighboring country, Angola. Master of Ceremonies, ladies and gentlemen, this initiative by IUM and Professor Namandi and his team brought 2 things to my mind. Number 1, that IUM and the Professor Namandi have the foresight to align and support the vision of our ministry, which is to be the leading provider of quality health care and social services according to international set standards. This will be impossible without the state-of-the-art medical equipment which you have donated to us today. This is a big step in the right direction. We thank you. We thank IUM for this. Secondly, Master of Ceremonies, ladies and gentlemen, the thinking of the ministry and the thinking of government is that as from the 1st of April 2026, all public servants, including the ministers, and Professor Namandi used to be a minister anyway, should be able to assess their health need in any of the health facilities and hospitals across the nation. So this donation of medical equipment is bringing us closer to the realization of this government's dream, which will be impossible without relevant medical equipment. Again, I really thank you, IUM, for this. This, your kindness, your foresight, and your partnership with the government will transform lives, as the impact of this donation will extend far beyond the Intermediate Hospital Rundu, but indeed to our 2 sister regions, as I just said earlier. IUM, Professor Namandi, and your team will make commitment in your presence today that this state-of-the-art and cutting-edge medical equipment will be put to use professionally and properly. We promise to maintain them with utmost care and to continue to striving for excellence in our patient care. Thank you so much. I thank our governor, despite his tight schedule, he's able to come here today. We acknowledge your leadership role in our region. We thank you, sir. At this juncture, I want to thank the dedicated staff of the hospital under the able leadership of Dr. Shivera for spearheading this arrangement of this important occasion. We thank you. I also wish to thank all our partners and stakeholders who has come to witness and celebrate this great occasion with us in this room. Thank you for coming. Thank you once again, Professor, for your foresight, for your unwavering support, and for extending your hands of partnership with our hospital, and to those we serve. May God bless you. Finally, I thank everyone who has come. May God bless you all. Thank you.
Thank you. Sorry, I would just like to acknowledge as well in our presence Ms. Leslie Davis, who has also traveled a long journey together with Prof, who is a group estate. I'm not sure, are you the procurement officer as well? Where the money is. So we just would like to thank you as well, and we hope you enjoy our region. We hope you come back. We hope you want to stay forever. And to continue pumping the money here. You will see the products. Please deliver. So we are done with our formal program. We would like now to proceed to the equipment. Mr. Poema, he's the one who's going to lead us. Just as we go out, perhaps we can take some refreshments. There's also the toilets along the way. I'm not sure which side we are heading. But there's toilets in the corridor. Just after the reception, left. The females and the males toilet. Restrooms. Thank you. On the right. On the right.
Have it all before?
We have it,
Okay.
but there are few. We have 3 theaters, and for now we are only running on 3. We're supposed to have 2 in each theater.
Okay.
Yes. So this one is an old.
For this
Yes. This one is an electric saw. They use it in orthopedic surgery. Yes, maybe the amputation to cut the bone.
I'm still not believing
Yes.
it. That's open it. Because you'll be shown a bank.
Yeah, it's here.
Okay.
So, Honorable, this is not easy to get. It's one of those.
Yes, we have been struggling.
Okay.
Electric saw. The time you'll be using sweating, the manual one. So this one is an orthopedic set, a full one. This one is a small fragment. We use it for upper limbs.
Okay.
Yes.
It's for repairing fractures of the bone.
Yes. This is the third diathem. Yes. We saw the other tools there.
Yes.
And this one is part of the electric saw. Yes, we have electric saw and an electric drill. Yes. So all these are part of it.
It's also for bar holes, huh?
Yes, it can be used in craniotomy.
This one also not open.
Yes. So this is part of this is an electric drill. It's also used in orthopedic surgery. Okay, we receive an emergency trolley. If you see our old one, we are very happy to receive this one. We have been struggling really.
No.
Yes.
But they look alike. It's the same.
The other one is old.
But it's old, but the model is...
No, not
Okay.
the same. Totally different. If you will see it there.
Okay.
So this is the second dermatome, the one I told you about skin grafting. We received 2. Yes, for now we are using Hamby knife. It's even manual. This one is electric.
Yeah.
But the other thing, we can go in theater too.
Oh,
That's why we set up the orthopedic. Yes.
Okay, okay.
Orthopedic traction table. We have already set it up.
It's already working. Ready to work.
Yeah.
It arrived work.
Yeah. It arrived today. This
And then it's set up already.
Yes.
You are ready to use it.
We are ready to work.
Okay.
So now the orthopedic doctors won't struggle, pull, instead they will use the traction.
Okay.
Yes.
So just to add, Honorable, you also remember we were in this theater with Honorable Prime Minister, and at the time we were complaining that that bed wasn't the one that was moving, you know, So whenever the doctors were pulling, the surgeons were pulling the leg. So now, so it's,
When I was operating, we were doing it, one person pulling, and the other operating. But now this one, you can mechanic.
Okay.
Yes, no, except this one, this one, the suction machine. Yeah, part of the commission.
That's a new one also?
Yes,
Okay.
we received 3. Yes.
Yeah, we needed this bed.
We really needed it.
Really, that's why it's already.
They were sweating, now they won't be sweating. You guys in pulling.
That's good.
The other diathermy machine is there. We have been struggling. We only had one which was working. We have to ask from the other departments, like dental, so we can use it. But now we are happy. All 3 theaters.
When you're operating and
Sorry. Yes, before you go, the new gowns. You want your new gowns. Oh, I almost gave it away. Okay. Please, let's not take the new gowns.
This is the one we ordered, and this one is all new. And they were very fast to set it up. They are fast to set it up. I didn't expect this. They just got them today.
With Sister Mtenya, how are you, ma'am?
I'm good, thanks. How are you, sir?
I'm good. Quickly tell us briefly the equipment that you received, and as a sister, how it's helping and how it will help, that is, with the procedures and processes within the hospital.
Okay, thank you for the question. Today we received a lot of instruments, a lot of equipment. For example, let's say we received an orthopedic bed. We have been struggling. We didn't have the orthopedic bed, and now we received diathermy machine. We have been struggling. We are only using 2 for 3 theaters. So one surgeon might not use the diathermy.
Wonderful. How does this make you feel, and as well as your work, how does it make it look?
As you can see me now, I am very happy, very excited for this instrument. Our workload have been lifted up.
Thank you.
So now we won't use manual anymore. We have electric drill, electric bed. So we are very much excited.
Thank you very much, ma'am.
Thank you.
This one is the UV light. They also use it in theater. When they are busy operating for a patient, maybe something it's like smelling that to prevent that circulation to be out of in the theater.
Will you finish all these boxes? Let's see.
And this one also phototherapy light. The phototherapy light, they use it on prime unit or OPD. When the newborn baby, they have to put it on the baby one.
Okay.
What is it? Jaundice
in yellow. When they have yellow coloring of the eyes.
Also be used by prime unity. If a baby is a premature baby, they just have to put the baby in the incubator.
Thank you.
This one also receive emergency trolley, like the one you see in theater. And
so maybe this for the outpatient or your casualty department.
Yes.
Prime unit.
Emergency unit. Yes.
OPD. Also receive
otoscope. What is that?
Yeah, this one is a meter you can use for a baby at for prime unity, but the nurse is a new thing for
No, but you're not talking to the nurse.
Yeah, but this is a new.
Oh, it's a bilirubin.
Yeah, this also is another patient monitor, this one.
Okay.
And we also received, they are all new. Another patient monitor here.
Yeah.
And we also receive a baby scale.
Baby scale. Okay.
And we also receive a dermatome, like the one you see in theater. This is a, no, it's a,
Yes, ultrasound.
ultrasound, a portable one for using the pregnant woman. And we also receive this is the syringe pump. Also another syringe pump, this one. For nutrition. And we also receive a medical pressurizing machine. Pressure for, I don't know if it's used in theater.
Medical pressure what?
Read it there.
Medical pressure. Pressurizer. Pressurizer. Also receive the anesthetic laryngoscope.
Yes.
Okay.
Also. This one will receive 10.
How many? There are 10 of them.
I think they are more than that. I think they are more than that.
And this one, they are 15.
Yeah, they are 15. Yeah. And then the big, just show us the big one.
Maybe in the big box.
We also receive another ultrasound sonar machine.
Yes.
This one.
Another sonar machine.
Ultrasound sonar machine. This one. And
The big one, the big box.
the big box.
Yes, let's see.
This one is a incubator, baby incubator.
This one.
Yeah, it's a baby incubator.
That big.
Yeah.
Oh, wow.
You can check it.
Oh, yes.
It's like this.
Yes.
Yeah.
Yes.
We have to install it also, then it will stand.
Yeah.
For putting babies also.
Yeah. The blood gas, eh?
And we also received the blood infusion warmer.
Oh, yes.
This one. We also receive it for infusing the blood. Yeah. And this one is also emergency trolley. The second one, the third one.
This is what
blood gas.
And this is a blood gas machine.
also an electrolyte analyzer.
Electrolyte analyzer. And this one is an anesthetic machine. The second one. Suction machine. There are two suction machine here.
Okay.
And you also receive an ECG machine.
Okay. Thank you. Oh, yeah.
This is the ECG machine. If you have a problem with the heart, then they use this machine. This one.
Yeah. Sure.
These are bed screens. Yeah, these are the bed screens.
We are done.
Here's another baby incubator. And we also receive a ultrasound machine. This one, a big one. And this one we also is a trainers for child for using it in rehabilitation, for training maybe a child maybe having a yeah. Then you have to train with this machine.
The small one was what?
Yeah, this one.
The big one.
Yes.
The bed also being used for the rehabilitation.
You can't lift it.
No. This one, they are four, they are the same thing.
Okay.
Yeah.